Peace. Hi everyone, this is Cassiecassie. Hey, I want to talk to you all some more about the um, medication Percocets and the chronic pain world we have out here today. I don't hear too much talk about it, but I want to be an advocate about patients that need their medication. I'm going to read one story. I'm going to read two stories and then we're going to compare the two. But the first story is it's about a person. For 20 years, she or he said that, I'm not going to say who it is, she or he said that they have been taking pain medication for over 20 years off and on. But for at least 10 years, they have been taking the Percocets for pain. And the doctor prescribed them Percocets, and it does work for them, but she or he said that they went back into the doctor's office and explained to the doctor that the pain medication does work good for me, but I seem to have breakthrough pain. After about 6 hours to 8 hours, it becomes very uncomfortable and unbearable. Is there anything that you can do or anything that I could take for breakthrough pain since what I have is not enough for me? And she said, or he said that the doctor said, does the medication work? And he or she said, yes, the medication does work, but it's not enough. And the doctor says, well, I can't prescribe you any more medication. That is it. That is the limit that we can prescribe for you because of the laws and how it is now. We can only give you the medication 4 times a day, and that's it. The patient went on to say that they politely left the doctor's office trying to understand the difficulties of why the doctor would not prescribe anything for breakthrough pain, saying that they were upfront and honest about their pain level and how the pain medicine works for them and how it would be a great help if they could have an additional second medicine that could be used for breakthrough pain. This person went on to describe that they can do some of their activities and some of their functions, but they cannot do all that they want to do or need to do because of the pain level. But if they had the second dose of medication, that it would greatly help, that it would be very beneficial to them in their everyday life. Not only would they be able to get up and dress and do a little bit of cooking or a little bit of shopping or a little bit of their activities that they would like to do per day to be a productive citizen, they can't because they are limited to the medication that they are getting. Okay, so that's my thing. This person is crying out for help. They are crying out for help for the doctor to help them with their pain situation. That is what the pain specialist is for, to help you manage your pain and help you to get through life's daily functions and activities with a little bit of medical help. That's why the medication is here. It's for the patient so that the patient can take it and have a normal to almost normal life function. But this person is still suffering because the doctor will not prescribe anything for their breakthrough pain. I don't think it's fair. I don't think it's right. I really don't. I really don't think it's right. Excuse me. My mouth gets so dry. But we're going to talk about the second patient. Now, the second patient has the same thing going on with them. And listen to their story. The second patient says, I am a 50-year-old with kids, and I've been on pain medications for over 20 years for chronic back pain with sciatica, herniated disc, and this degenerative disease. All of that being so, I was prescribed 80 milligrams of oxycontin 3 times daily with oxycodone 30 milligrams immediate release for breakthrough pain. I was able to function, work, and do my business. Now, because of the opiate crisis, my doctor tells me I no longer can take this medication and has taken me down to 30 milligrams of oxycontin 2 times per day and 20 milligrams of oxycodone up to 2 times a day. Now you see what I'm talking about? This second person is complaining because the doctor took them down their 2 medications per day to lower dosage. And these medications also help this person, but they only can get it 2 times a day, but they have 2 different medications working. One is long acting, and one is right then that it works like maybe 15 to 30 minutes after you take it. And they are saying that they cannot function with the reduction of the medication, that their quality of life is very poor now since the doctor has taken them down from their medications. I don't think it's right. Why? I don't think it's right. So this second person had to be taken down only twice a day, but they have 2 medications. The first person only had 1 medication and had the same problem. But I wonder what the difference is. I wonder what the difference is. The first person is suffering, and they're younger than the second person. And they're suffering. The first person is suffering. They can do their things, but they're not able to do what they really need to do because the doctor will not prescribe them the medication, but only 4 times a day. Now, if they have breakthrough pain, then what? They cannot take anything else. They just have to suffer. They have to suffer. They have to lay there and suffer. If they don't or can't take their kids out, or if they can't have any more medications, they can't go shopping, they can't go out with their girlfriends or their boyfriend or the guy friend, or they can't really concentrate, or they can't really interact with their kids, or they can't really have friends or associates or go on trips or do adventures because they're limited to their medications. The doctor only will prescribe it only 1 time a day, only 4 times a day. But if any other pain arises, they're fucked. They can't take anything else. They just have to endure with that. Second person has 2 medications, but in the same situation, they can't do what they used to do because the doctor has taken them down off their medication. I think that it is unfair to the patients that suffer from chronic pain. Chronic pain is different from you're just taking it because you want to take it to get high or to feel good or to feel the whatever it feels, the high of it. It's totally different when you're in pain and you're laying in your bed or you're laying on the floor and you're suffering and you're in pain and you don't know what to do and you cannot think, and the only thing you can do is cry and shake and moan. And when you take that medication and it works for you and it gives you a relief and you're able to do a little bit more than what you normally can do if you did not have the medication, it's different. It is totally different than someone taking it that's does not have pain. But if you have pain, it gets in your bloodstream and it works different. I'm telling you, it works different. It's not addictive if you are truly in pain. If you're truly in pain, it's not addictive. But if you are a person that wants to motivate your whatever, and you're just taking it for the feel, okay, that's different. But if you are a person and you need it, and you need to take your pain medication because you can barely walk, or you can barely move your legs, or you can barely stand up straight, or you can barely interact with your kids. You can't go to the playground or go shopping with your kids because you're in pain, because you can't get the proper care that you need. Excuse me. You can't get the proper care that you need. And I think it's sad. I think it's so sad because they call these people addicts. And I don't really get it because they're limiting your function. Your your function. There's not a right in it. Because there are people that are taking it that don't need it, that are dying, that are dropping dead every day. They're dropping dead every day because they're taking it and they don't need it. And then there's patients that need it and can't get it. And they're laying in their bed or laying on the floor while their family and their friends are going out and doing things and cooking and doing the laundry and washing the cars and just every day reading books or just concentrating. It's difficult when you're in pain. When you're in pain, it's totally different. It's totally different. Excuse me. It's totally different when you're in pain. But people that are in pain are considered addicts, and the doctors are reducing their medications. The doctors are seeing them in like every 2 weeks. They are getting blood tests. They are getting urine tests. They're getting tests to see if the medication is in their system, to see if they are selling the medications. Now, I know I've heard, and we all have heard of people selling their medications because they want to drive fancy cars or do certain things or wear fancy clothes or wear fancy jewelry and do all of these exotic things with their money from their medications. But there are some people that are not selling their medications. They really need it. They really need to take their medications. But they can't effectively function because the doctor is not prescribing the medication amounts that they need. Because of the crisis, because of the people that are dying every day, the people that are dying because they're taking 5, 6, 7 Percocets or 8 Percocets at one time just for the feel good of the situation. And then you have these other people, you have these grandmommies that need it. They want to go and pick up their grandchild and play with their grandchild more than 15 minutes. They want to play with their grandchild. They want to go out with their friends. They still have a good quality of life if they can get the medical care that they need. But they're being swept. They're being swept up under the rug. They're being, like my mom used to say, they're in a donut hole. They're those percentage of people that falling through the donut hole that's not getting proper care because they either make too much or they make too little, and they falling in the donut hole. They don't qualify for some of the programs. My mom used to say that all the time. God rest her soul. She's dead now. Okay? But there you got these people, these grandmothers and granddaddies, and you got these young mommies that are born with these illnesses or have these illnesses, and they want to live a productive life. They want to be able to do their own hair. They want to be able to walk and spend time with their families and be with their kids. But the quality of life is totally different because they have pain. They have chronic pain. And the doctors are busy. They're making their money. And you go to these pain doctors' office, the office is full. The office is full. And you sit and you wait 2 and 3 hours, and the patients, they get the medication, and then they have to come back and be prescribed more medication after they do drug tests and screenings and all of this here, and the doctors sit there and look at them and meditate on them and see how they function and how they act, because I know the doctor told me that's what they do. Not the doctor that I'm currently going to, but a doctor. I asked him, how does that work when people are on pain medications? He said, yes, of course. The doctor has to sit and evaluate them because I did go to college. And yes, I did ask them about it because I know people in my family and some of my closest friends, they're suffering. They are suffering. They are suffering because they're not getting the pain medication that they need. If a one specific pain medication works for you and is doing you good, then why not, doctors? Why not? Why? And they're up under your care. You can see them every month like you do. And if it's working for them and you're getting good steps and vibes for them, why not help them with their situation in dealing with this chronic pain? That's my cry for some patients that are not getting the care that they need. I want to be that voice to let people know there are people that are suffering. They're suffering. They're either shame or they're either, you know, they're in these families and they're trying to do the best that they can. They're trying to have good jobs. Are they trying to be good homemakers? Are they trying to be good moms? And they're trying to be good dads? They don't want everybody to know that they take Percocets. You know? They don't want everybody to know their personal medical business. It can be shameful. So they go and they don't say anything. They're quiet and they're suffering. And then there's people that are out there that are getting it in the boatloads. I don't know how they're getting it, but you read about it every day. You read about it every day about how certain people are getting Percocets, Oxycontin, and Oxycodone in the abundance. It's heartbreaking. It's heartbreaking. God put man, smart people on earth, doctors to help people to be there, you know? They're practicing medicine. We don't expect them to know everything. But if a doctor see that you're in need and you're suffering, I think that there should be something done about it. I think that the doctors need to take a second look at what they're doing and see that the people that have chronic pain, they're not just addicts. They are good people, good moms, good grandmoms, good aunties, good sisters, good husbands and uncles and granddaddies, and good friends. They just need a little bit of help with the knowledge that God has stored upon these doctors in order to help people that are in need. So to all the chronic pain people out there, I'm going to be a voice and I'm going to speak up. And this is not going to be my last talk about it. I'm going to talk some more about it because I think it's a topic that needs to be discussed. Because there are truly people that are suffering, they're good people, and they need proper care. Okay? So, you that are listening, if you have not subscribed to my channel, please subscribe to my channel, Cassiecassie. Share me, tell me to someone else, share me, and leave me some comments. Let me know what you think and how we can talk about this and how we can make a move for proper care, for proper care from the pain specialist, for people that have chronic pain, people that have chronic pain, people that are suffering and they are in need. So if you have not subscribed, please subscribe to my channel, hit the like button, and we'll be talking again. It's Cassiecassie. I love you all. Peace. Love you all. Peace.